My name is Jenna Carty, and today I will be discussing COPD. COPD is a common progressive illness that takes years to develop, and yet is the third most leading cause of death in the U.S. COPD can occur almost without you realizing it, and after living with or near people that have smoked or have breathing disabilities, you see how it affects them. Learning the possibilities for the future keeps everyone informed. COPD is a lung disease that causes blocked airways. No air means no oxygen means death. COPD stands for chronic obstructive pulmonary disease, and it comes with a whole bunch of different symptoms such as wheezing, difficulty breathing, mucus buildup, etc. Luckily, there are treatments available to help counteract the effects. COPD is a chronic inflammatory lung disease, and it causes obstructed airflow from lungs caused by long-term exposure to irritated gases, particulates, and smoking. COPD often occurs in people exposed to fumes from burning fuel for cooking and heating from poorly ventilated homes. Examples of COPD are chronic bronchitis, which is inflammatory of the lining of the bronchial tubes, as well as emphysema, which is a condition in which the alveoli at the end of the bronchioles of the lungs are destroyed as a result of damaging exposure to smoke and other irritating gases and particulate matter. Many misdiagnose COPD as late onset asthma, and while asthma and COPD are both obstructive lung disorders characterized by chronic airway inflammation and airflow limitation, asthma is characterized by widespread variable and reversible airflow obstruction, while COPD is a persistent airflow limitation. As previously stated, symptoms are difficulty breathing, coughing, mucus buildup, and wheezing. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time. People with COPD are at an increased risk of developing heart disease, lung cancer, and a variety of other conditions. Globally, in 2015, 3.2 million people died from COPD worldwide, an increase of 11.6% compared to 1990. Death from COPD were 8 times more common than death from asthma. In the U.S. today, COPD is the third leading cause of death and affects 16 million Americans diagnosed with the disease and millions more who likely don't even know they have it. COPD is a disease, and at present, there are numerous studies that have shown variability of the clinical presentation of COPD in various contexts. This variability has been shown in symptoms perception throughout the year, during a month, a weekly, and even a daily cadence. In short, while COPD is active and deadly, the symptoms are generalized and can be misidentified as other diseases. It doesn't help that COPD affects people differently. However, when diagnosed properly, the two main approaches for current drug in management of stable COPD are bronchodilators or broncholators and anti-inflammatories. There are also tests and scans to help with proper identification, as well as testing to see how strong and or functioning your lungs are, as well as steroids, antibiotics, and inhalers to help with symptoms of COPD. Chronic obstructive pulmonary disease is a lung disease that can have deadly results. It can affect you slowly, but its symptoms are ever present. If you show symptoms of COPD, you should see your doctor, express your concerns, and get tested. And if diagnosed, work with your doctor to gain effective treatment. I think it's best to keep everyone informed on the diseases that run rampant in our world. With everyone informed, we can then better identify the symptoms and actively work to better ourselves and the world around us.